Under the theme Facing the Challenges, global experts gathered at Sicem 2025 to discuss endocrinology's responses to new challenges and to shape future directions together. The 13th Seoul International Congress of Endocrinology and Metabolism, Sicem 2025, held in conjunction with the 44th Annual Scientific Meeting of the Korean Endocrine Society, brought together experts from around the world in Seoul, serving as a global platform guided by the theme Facing the Challenges, where the latest scientific knowledge, clinical insights, and innovative research in endocrinology were shared. Building on more than a decade of Sicem's legacy, this gathering was not only a moment to reflect on past achievements, but also an opportunity to look ahead toward new ideas, global collaboration, and the future of endocrine medicine, marking through meaningful dialogue and lasting connections another important step forward for our field. Through meaningful dialogue and lasting connections, Sicem 2025 marked another meaningful step forward for our field. Professor Mingjao Xing, a distinguished expert in thyroid cancer genetics, has investigated genetic alterations in the MAPK pathway and mutations in the telomerase reverse transcriptase gene promoter. In this lecture, he discussed the critical role of the genetic duet or trio of these two major genetic changes in thyroid cancer. This lecture provided new insights into the genetic-based risk stratification of thyroid cancer. Professor Eugene McCloskey delivered a plenary lecture on intervention thresholds in osteoporosis and other non-communicable chronic diseases. Professor M. Reinke provided the audience with an insight into the current status of primary aldosteronism by discussing whether screening tests for primary aldosteronism should be performed in all hypertensive patients. Professor Rohit Kulkarni presented groundbreaking findings on M6A's function in beta cell biology and adipose tissue regulation. This session explored the emerging epitranscriptomic mechanisms underlying diabetes and obesity. Potential therapeutic targets for metabolic diseases was also be discussed. This symposium serves as a platform for discussing cutting-edge research, clinical innovations, and regional perspectives on thyroid disorders. Through expert presentations and in-depth discussions, the symposium aims to enhance collaboration, drive scientific progress, and improve patient care in the field of thyroid disease. ESAKES Joint Symposium addressed misconceptions about anti-resorptive agents and discussed practical treatment strategies. Professor Christian Gurgis presented insights on denosumab discontinuation. Professor Song Hae-gong examined its necessity in dental procedures. And Professor Han Eung-wen discussed managing atypical femur fractures. This session provided key updates and clinical insights on osteoporosis treatment. Day 2 of Sicem 2025 featured a full day of scientific exchange, with parallel symposia covering advances in glucose monitoring, thyroid and bone health, pituitary and adrenal disorders, and emerging targets in metabolic disease. The program also included oral presentations, poster sessions, and plenary lectures that highlighted both cutting-edge research and practical clinical insights, bringing together diverse perspectives across the field of endocrinology. This ESKES Joint Symposium explored the growing burden of diabetes. Professor Jason K. Kim began the session with a talk on precision medicine for chronic metabolic diseases. Following this, Professor William Herman examined the cost-effectiveness of diabetes prevention, and Professor Soo Hyun Kwak highlighted the challenges and opportunities of genetic information in precision medicine. This session provided key insights for advancing diabetes management and prevention. This symposium focused on glucocorticoid-induced adrenal insufficiency, featuring 2 expert speakers from ESE, who presented the latest updates from newly published guidelines. The symposium was conducted in an interactive format with live Q and A sessions to enhance engagement and discussion. Additionally, Mi-Kyung Kim from KES shared insights on the Korean status and data related to this condition. This session provided valuable knowledge and diverse perspectives to enhance clinical practice. On Day 3, Sicem 2025 continued with focused discussions on diabetes, lipid metabolism, thyroid and adrenal disorders, as well as skeletal muscle and osteoporosis research. The day featured joint symposia, plenary lectures, interactive sessions, and poster presentations before concluding with the closing ceremony, bringing the Congress to a meaningful close. Sicem 2025 is hosting a year in review session that spotlights the latest research and treatments in diabetes, thyroid, and bone metabolism. This session offers a valuable opportunity for healthcare professionals, researchers, and students in endocrinology and metabolism to stay updated and engage with leading experts in the field. Sicem 2025 concluded successfully, leaving behind meaningful milestones for our community. Now, we look ahead. With an even stronger program, Sicem 2026 awaits in Incheon. We look forward to seeing you there.